Hi, my name's Alexia, and I'm going to be performing your assessment today.
Hi.
Before we begin, I just want to make sure I have my stethoscope, my pen light, a pair of gloves, and some hand sanitizer. Can you just do me a favor and tell me your name, today's date, and our location?
Yes, so my name is Olivia. Today's date is November 4th, 2017, and we are in Old Orchard Beach, Maine.
Okay, good. Olivia, have you been experiencing any pain today?
No.
Okay. If you do at all throughout our procedure, our assessment, just let me know and we can take a break.
Okay.
Do you use any assistive devices like hearing aids or glasses or contacts?
Yeah, I wear contacts. They're in right now.
Okay, good. Do you have any questions?
No, not that I can think of.
Okay. So before I focus on your eyes, I'm going to give you 3 words, and I'm going to have you repeat them to me, and then I will have you repeat them at the very end of our assessment, okay?
Okay.
So the 3 words are trick or treat.
Okay, so trick or treat.
Okay. So the patient is conscious, alert, and oriented times 3. She demonstrates clear speech and articulation. I'm going to have you, I'm going to test your eyes now.
Okay.
So it might be a little bright, but I just want you to look at me, and I'll just let you know what to do after that.
Okay.
And now I'm going to bring the pen light towards your face, so just look right at it. You might go a little cross-eyed.
Okay.
Okay, good. And just to test your peripheral vision, I'm going to reach behind you and wiggle my fingers, and when you see them, just tell me to stop, okay?
Okay. Stop.
Okay, good. That was good. So the patient's pupils are equally round and reactive to light. Accommodation is present. Peripheral vision is intact. Before we finish and before we move on, can you just lower your lower lid, just pull on them gently? Okay, thank you. Okay, so the patient's eyes, upon inspection, the conjunctiva is clear. The sclera is white, clear, and smooth. There was no redness or swelling or any exudate. So if you could just close your eyes for me, and I'm going to use my pen light to touch 4 points on your body, and just let me know where you feel it, okay? So close your eyes. Good.
Right shin.
Good.
Left shoulder. Left foot. And right shoulder.
Good. Very good. Okay, so the patient sensation is fully intact. So if you could just take your fingers and meet them to your thumb, each one. Very good. So sensation and point localization are fully intact and appropriate. I just want to assess your motor function of your facial muscles. Okay. So if you could just smile for me. Good. Frown. Puff your cheeks out. And raise your eyebrows. Good. So the motor function of her facial muscles is appropriate and equal bilaterally. So moving on, the patient is able to respond to verbal cues as well. I'm going to inspect your head. So first I'm going to palpate your scalp, and then I will inspect your hair, just for any infestations or lesions.
Okay.
So upon palpation, the skull is round with no deformities or tremors. Hair inspection, the hair is evenly distributed. There appear to be no signs of infestations or lesions That's good. And then we'll move on to your nose.
Okay.
So if you could do me a favor and block one side of your nose, one nostril, and breathe in. Good. Okay, and do the same for the opposite side. Good, very good. Okay, so I'm going to use my pen light and just get a look. Good. Okay, so upon inspection, the nares are clear. There is no swelling or drainage. The patient's nasal patency is equal bilaterally. So we'll move on to your mouth, okay? So first, the lips appear, there's no breakage or signs of skin breakdown. There's no lesions or anything. So if you just open and say ah, and stick your tongue out a little. Good. So the uvula is midline. The tonsils are present, but there's no swelling, there's no inflammation or drainage or anything. There's no signs of infection. The oral cavity is pink and moist. The tongue is symmetrical. And the teeth demonstrate good dentition. There was no foul odor as well, so good job. So after that, we'll move on to your ears. And so what I'm going to do is I'm going to look inside of them, and then I will perform the whisper test, okay?
Okay.
So the ears are fully developed. They are warm and pink to the touch. There was no swelling or drainage. And so I'm going to perform the whisper test. So I'm going to whisper a word on each side and then just repeat to me if you can hear the word.
Okay.
Okay? And what word I'm saying.
All right.
Okay.
Peanut.
Good.
Brittle.
Good. Good. Okay, so the patient's hearing is fully intact and appropriate. The next thing we can assess are your sinuses.
Okay.
So I'll assess your frontal and maxillary, and so just let me know if there's any sensitivity or tenderness. Have you noticed any changes in?
No. No.
Okay.
No tenderness.
Okay. Good. Just to kind of ask a question because I forgot before. Have you noticed any changes in your eyesight, hearing, or sense of smell? Or taste even?
No, not at all.
Nothing you've noticed?
No, except
Okay.
I just go for my my regular eye exams, but
Yeah.
that's it, just for my contacts. But
That's good.
Yeah.
That's good. Obviously, if you notice any big changes, then obviously alert your physician right away.
yeah.
Or come into a clinic. So I don't need this. So I'm going to test your sinuses.
Okay.
I'm going to palpate them. So upon palpation, there's no tenderness or swelling. So now I'm going to check your lymph nodes. And so I'll check right here. And go behind. And also your supraclavicular. And those are good. Okay. So, I'm going to move on to your trachea and your thyroid. So your trachea is midline, your head is erect and centered. There's nothing, it's not out of place, I suppose. Your thyroid is non-palpable, but could you just swallow for me? Good, so swallowing is appropriate. And then before we finish up, I'm just going to assess your skin,
Okay.
and then I'll ask you those 3 words again. Okay?
Okay.
Okay, so your skin, I'm going to check your hands first. Oh, you're warm.
I know.
So the skin is warm, pink and moist. There's no checking the skin turgor, rapid recoil, brisk recoil, so that's good. And your cap refill is under 2 seconds. Good, good. So that means you're pretty hydrated. That's a good sign.
I try to work on that.
Yeah, and there's no edema or anything. Do you have any questions?
No, not that I can think of.
Okay, good.
None that come to mind.
Okay, good. So would you mind repeating those 3 words for me?
Sure. Okay, so the 3 words were trick or treats.
Good. Okay.
Okay.
So as you know, this video is for educational purposes, and I was wondering if it's possible for me to post this on YouTube or another social media site so that we can share it with our professor.
Yeah, that's okay. No problem with that.
Okay, good. Thank you for your time.
Thank you.